Hello, my name is Terry Garnica, and my presentation this evening will be on diabetes. Who's next? Type 1 or type 2 diabetes? That is the question, and that is the debate or the discussion tonight is what is type 1, what is type 2, what are the difference between the two. I will also address symptoms of type 1 and 2, rumors and debates between the two, and the affordability or lack of for diabetes in general and the population of people with type 1 and type 2. So let's get started. Type 1 versus type 2. As you see here, type 1 is typically age of onset would be a juvenile, although you can get it as a young adult. The progression is abrupt. It's severe or fatal, the symptoms, if you're unaware that you have type 1 diabetes or are going to have symptoms appear, they're going to be very quickly, and oftentimes, if misdiagnosed, they can become fatal. And the treatment is insulin with no cure. Type 2 diabetes, general onset, is an adult. However, obese children and obese children with very poor diets can develop type 2 diabetes, and it is becoming more prevalent these days. It is a gradual onset based on weight gain, and they are less severe symptoms to type 2 diabetes, although there are side effects long term. It is not an instant or as severe or abrupt as the type 1, and treatment is weight loss or oral medication and cure with a question mark. And you may say, why the question mark? I will cover in this section of rumors and debates, is there a cure for type 2? Some professionals will say, yes, there is a cure. You can be cured of type 2 diabetes, and others will say that you simply go into remission and aren't exactly cured. So we'll discuss that shortly. Symptoms of type 1 are vomiting, and you become lethargic. You have rapid weight loss, which is opposite from what you would see in type 2. Sweet smelling breath, burning while urinating, dark circles under your eyes, bedwetting, and frequent urination. Oftentimes, type 1 diabetes goes undiagnosed because oftentimes the doctors will say vomiting, stomach flu, if they're lethargic, could be from fever or from possible dehydration. Rapid weight loss because of the amount of vomiting, could see some 2-3 pounds, which is a lot for a little one. And then the burning while urinating is often misdiagnosed as a yeast infection in girls or bladder infection in either boys or girls. Dark circles under the eyes often are misdiagnosed as lack of sleep or genetic predisposition. Bedwetting and frequent urination from drinking water before bed. The doctor would say the child is not developed enough to not wake up to go to the bathroom, or sometimes I've heard they just sleep too deeply, put a pull-up on them. So those are all common misdiagnosis for type 1 diabetes. Type 2 symptoms, again, type 2 is very gradual. So testing when you're overweight, testing your A1C will show it climbing, becoming more tired over time, but you don't get the same symptoms, the rapid symptoms that you do see in type 1. I'm going to discuss some rumors and debates between diabetes. One of them being is there is a cure for diabetes, and that's what you'll hear people say in general when they categorize diabetes as one term versus two terms, type 1 and type 2, which leads us to the next one. Type 1 and type 2 are the same. You can go back and forth between the two types. Diabetes and depression aren't linked. Children are not capable of self-care, and diabetes care is not affordable. So the first one we're going to address is there a cure for diabetes? Type 1, no, there's no known cure. They've been saying for several years, and they've been working on a cure for several years. However, they have not come to find one yet. They always say they're close, but I've been hearing that for several years now, and so far nothing yet. Type 2, some scholars will tell you that there is a cure. Others will say, again, that they go into remission. And the cause of type 1. Type 1 is an autoimmune disease, and you can't stop it from happening. There's no known cure. It doesn't occur because of anything the mother did or didn't do while she was pregnant. It's not from poor diet or too much sugar. It does not discriminate. Type 1 diabetes can happen to anyone. And the only cure, again, for that is insulin. Type 2 diabetes, the cause is being overweight or poor eating. And oftentimes a type 2 diabetic will blame themselves for getting diabetes because it is typically their fault. It is can be genetic, but most of the time it's because of overeating, obesity, and poor eating habits. Can you go back and forth between the types? I have read from different articles, and a majority of them say no, that they are very unique and do not go back and forth. Type 1 diabetes not associated with weight loss, and the other one saying that type 2 is often associated with excess body fat and body weight. And when you lose weight, then generally you're cured or in remission, depending on whose belief you choose to believe. But I did read another article saying that there was a gentleman with type 2 diabetes who lost weight, took the oral medication, and in his early years, he was obese. Early years meaning early 20s, and developed type 1. Although they are different, the study said that it was possibly coincidental, not linked to the fact that he had type 2 previously. Here is a debate among a lot of scholars. Diabetes and depression, are they linked? Some scholars say that they are situational, that because they have diabetes, they're different from others. They don't want to deal with this. It is depressing because, especially in children, they are different and they have to do things differently. They can't just eat the same way that their friends do. They have to stop and go through a process before eating, and it does weigh on them, and so that's situational depression. Other scholars say that it is a chemical imbalance, that your body makeup is different. You have an autoimmune disease, and it can affect your the way that your chemical imbalance, causing depression and anxiety. It can also be from lack of support. If you are not supported through your journey through diabetes, And then oftentimes that leads to suicide or suicide attempts or thoughts, because they just don't want to deal with it anymore. In my experience, my almost 9-year-old daughter was diagnosed at age 3, and occasionally we'll have a breakdown of, I hate this, why me, what did I do wrong, why can't it be someone else? We hear a lot of that, and she's only 9, so we do anticipate even through puberty that it'll be something that we will have to deal with. Another rumor, or debate, I should say, are that children are not capable of self-care. This video I'm going to show you is my daughter at age 3. This is 2 months after diagnosis. We do not micromanage her. And what I mean by that is we do watch closely, but we allow her to take part in her care. We always have. We've taught her how to care for herself. And we are very supportive of what she wants to partake in. Experts say that between ages 6 and 10 are when you should start teaching children about self-care. However, we started teaching her right away, and this video is her actually giving herself her own shot at age 3. Ready? Ready?
Can Dad come watch me? Can Dad come watch me?
Can the daddy check? Okay, hold the needle. Let's calm down.
That is fantastic.
Okay, next slide. Diabetes care is not affordable, and that is absolutely true. Depending on, again, who you're talking to. But I did read a lot about the prices of insulin, and one particular story of a gentleman who could not afford his insulin. He would get to the point where he needed medical care. He would go to the hospital, get treatment. They would give him a vial of insulin. He would go home, use that insulin throughout as much as he spread it out as much as he could until he ran out. And then again, go through the process of not being able to afford it. So he got sick again, then went to the hospital. That is a very common story, sadly. But there's an Affordable Insulin Act of 2018 and Access for All Act of 2019 that's currently in Congress waiting for the bill to be passed. And other programs in place to help with a question mark, meaning there are a few without insurance. They are not very helpful if you have no money, but they do give a break to allow people without insurance to at least have some sort of break, but still very expensive. And with insurance, I'm fortunate enough to say that I don't have an issue, but even with insurance, we pay $25 a month for our insulin. So not having insurance at all would definitely be detrimental to my daughter's care, and is to many people's care. So hopefully those will be addressed very soon. Here are my references that I'll run through very quickly. And then I would like to leave you with a final video and a final thought. I appreciate you watching. Wanted to leave you on this note. This is a video of our daughter, age 3, in the hospital 2 days after diagnosis. You can teach a child if you put in the effort, and you can educate yourself and others so that a life may be saved if you recognize the symptoms. it's worth trying. So here is the video. Enjoy. So what's the diagnosis, doctor? What does Rufus have?
He has diabetes, and so we can't get him to get Fincher, and he has diabetes.
Okay. So what are we gonna do? What do you think?
I'm checking him. So the tweezers are under it.
Okay. What are you gonna check on Rufus if he has diabetes?
He likes me a checkup, and we're doing it right now. So I gotta give him a little poke with the my finger blood poke. Now what is that? Can you get my doctor? Can you see if it's in there, please?
Certainly can. Here it is.
Thank you. Just gotta hurt a little.
Mama, working
Okay, now Okay, it's bleeding. Now put a band-aid. Beautiful band-aid. This is a beautiful one. Beautiful band-aid.
Does he need to have insulin?
Yes.
Where are you gonna give Rufus a shot?
Maybe doing it right here. On his butt.
Can you show me all the spots you could give it to him? His belly. Where else? His legs. His bottom. And where else? Okay, there's one more spot. Somewhere on his arms. There you go, on the back of his arms, right?
Right here.
Okay, so where might you give Rufus a shot tonight?
Maybe doing it right there, right here.
Okay, pick a spot and give him his shot.
Don't you want it on his arm?
Why don't you let Rufus pick?
Rufus. Do you want it right here? Right here. On your belly? Okay. It says on his belly. I mean, on your leg, Rufus? Can't see his eye. Yeah? His leg?
If that's where you want it, yeah.
His legs? Okay. Blue or orange? Blue?
So how do you hold his leg? Yep.
And 1, 2, 3, 4.
Good job.
Good.
Now give him a
boy,
hug.
Rufus.
There you
Good boy,
go.
Rufus.
Little Sam.